Hello.
Action.
Hi. We are here to present an instructions video for our patients for the procedure of LANAP, L-A-N-A-P.
This is Dr. Jin Kim, and my name is Gabby. I'm part of the clinical team here at the office, and today we're going to walk you through step by step how to take care of yourself while at home after the procedure. Now, Dr. Kim, why don't you tell us what LANAP is?
Okay, let's start by talking about the LANAP procedure. LANAP is a periodontal surgery procedure. Traditionally, periodontal surgery has been done using what's called flap. Flap is where you literally take the gum off the bone to be able to get to the disease site, as you can see in this picture. But of course, the downside is it's uncomfortable. It causes a lot of tissue shrinkage. So for about the past 15 years in our practice, we've been using this particular technique called the laser-assisted new attachment protocol, LANAP for short. LANAP is the only FDA-approved periodontal disease treatment that is available in the United States now, and you have to be a certified clinician to be able to operate this protocol. Just a quick video here. This video is actually available online. You can look up my YouTube channel and find this. This is a case where we have found some bacteria on the patient's mouth. So the little squiggly things, those nasty things, were actually bacteria. We are doing killing the bacteria that's on the microscope slide with the laser. What was in my hand is laser. As you can see immediately, the spirochetes, the deadly bacteria that was crawling around, dancing around, are now motionless and dead. So this is how potent laser is.
So, Dr. Kim, are you saying that those little bugs are living inside people's gums?
Exactly. What you're seeing on that screen right now, you see those little dots of little creatures? The big chunks that look like big land and what's looking like sea, what's floating in the sea are the bugs, and what's looking like land are the host cells. So these bugs are floating around, they live inside our cells, they live between the cells, and so on.
Wow.
So this LANAP has been around for quite some time. I've been using it personally since 2011. These are some of my esteemed colleagues who are on the same team. Well, this has been around. It's still not the majority. About just under 50% of periodontists, specialists like myself in the United States, are using it currently. But I have had the privilege to be able to lecture, teach, and share the techniques with the rest of the professional colleagues here and abroad for the past decade or more. In fact, I've been one of their poster child, so they actually use my picture in many of the big dental meetings. And here's a picture of the innovator, the inventor, and his wife, Dr. Greg, and my son in front of that poster, same poster, just recently.
Okay, Dr. Kim, so now let's go into the post-surgery instructions. So what is the goal after LANAP protocol?
Of course, after any surgery, people are going to be nervous and uncomfortable, and we want people to heal in this the most effective and the easiest way possible. And of course, the body has that potential, the natural healing potential. We simply have to find that and tune into it so that we get the most out of the body's healing. Swelling is inevitable. The faint graph, the big one, tells us that for almost up to 2 weeks the swelling can exist, but we prefer the smaller, darker red blimp. Just a small amount of swelling for 7 days. I really want it to be less than that. And same thing with the pain. We don't want a big bump in the graph as time goes, maybe 3 or 4 days, and things plateauing and just disappearing. That's our goal.
So the first step we can do in minimizing the pain and the swelling is to do something as simple as using a cold pack. And you're going to use this cold pack 15 minutes on and 15 minutes off for the first 3 days. It's really going to help bring all of those symptoms down.
Again, cold is our friend. Right after the surgery, cold is our friend until the swelling and the pain goes away. We saw the graphs before. We want the graphs to bump up slightly and disappear fast. And cold is the magic that does that.
Another thing we can do, the cold pack is going to stay on the outside, but in order to keep the inside of the mouth cool, we're going to take an ice cube and let it melt inside the mouth. This is going to help keep the area, just like Dr. Kim said, cold for as long as possible.
So holding ice cubes in the mouth gently and also rinsing with some cold water is an excellent method to achieve this goal. Now, this is the time to not use any other commercial rinses.
Rinses like Listerine or anything that's over the counter. We have a specific regimen that we inform our patients to use after any dental procedure here in our office.
Remember these mouthwashes, which is very commonly used for all sorts of reasons. To be frank, they're not very effective in a treatment modality, but especially after a fresh wound has been created after surgery, it's a definite no-no. Please stay away.
Another thing we're going to have to stay away from are physical activities. If you're anything like me, then it's going to be a little bit difficult for you not to get to the gym, but that is something that's critical in the post-operative healing after any procedure, especially LANAP. Means no exercise, no gardening, no walking. We want to discourage any activity that's going to increase your heart rate, get your blood flowing, because we want to actually minimize the blood activity in the mouth.
This is a good time to really chill out, relax, read a book, watch movies, and let all the people around. You deserve it. You went through a tough time. No physical activities until the visible swelling is gone.
This is going to transition us into using our Stella Life post-operative kit regimen. We have 3 products that we promote here. It's all part of our kit. We're going to use the Stella Life spray underneath the tongue. The Stella Life rinse will come afterwards, and the Stella Life gel is going to be the last step.
Stella Life is a product that has been on the market for quite some time. They call it the Intelligent Healing. It contains all natural ingredients. These ingredients will enhance the healing activity. It will suppress the bacterial growth and keep the mouth relatively hygienic. The first spray is used under the tongue, and this is a systemic effect. It's best done early in the morning. You wake up in the morning and you spray it under the tongue liberally and generously. It will bring all the right ingredients into the body, into the stream, because medications do get absorbed under the tongue, so that's what you want to do. However, you are free to do this more than one time throughout the day.
Dr. Kim, is it possible to overuse Stella Life?
No, the answer is no. So the product is natural ingredients. You can swallow it, you can spit them out, but don't be afraid to swallow some excess in the mouth. For instance, a rinse is used after each time you eat. We're going to go over the toothbrushing method later on, but you rinse with cold water, especially if you're having a snack or a meal. Just get rid of all the food debris. Brush only the biting surfaces, and then use the Stella Life rinse generously. We want this to soak in every corner of the wound. And lastly, we use the gel. The gel is something that, because of the viscosity, it stays on. And here's a short video that describes it. Here's some gel that's put into a small cup. And here I'm using a Q-tip, a cotton pellet, and then basically applying directly onto the wound. Don't be afraid. The wound is delicate, but you can gently touch the wound. Now, if you're not comfortable with this, you can also put some on the tip of your tongue and roll it with your tip of the tongue, and that's another way to use it.
The next topic we're going to cover is medication. We do have to use medication after dental procedures. This means antibiotics and anti-inflammatories like ibuprofen. This is going to help kind of create a predictable outcome for the healing.
The first and the most important thing is antibiotics. Although post-surgical infection is extremely rare, we recommend that antibiotics be used for about 3 days or so. Unless it's a major procedure, most of the LANAP procedures after 3 days, if there's no fever, no swelling, excessive swelling, no discomfort, and so forth, after 3 days it's customary to put the patient off. We customarily prescribe 7 to 10 days to begin with. Don't be confused. It doesn't mean you have to take it for 7 to 10 days. Some cases we do, but most cases after 3 days is not totally necessary.
The next topic we're going to cover is ibuprofen. Dr. Kim, why do we have patients take ibuprofen and not something like acetaminophen or naproxen?
Good question. A lot of people say, you're going to give me ibuprofen? That's not strong enough. I need something stronger. And that's usually the response of many patients. Ibuprofen is used for post-surgical procedures because they belong to a group of medications called NSAIDs, non-steroidal anti-inflammatory medications. And the important thing is the anti-inflammatory. Ibuprofen pills are 200 milligrams each, but we prescribe something in the vicinity of 600 to 800 milligrams. It is to be taken every 4 to 6 hours for somebody who's healthy, strong guts, and good body weight. So long as taken with plenty of water and food, ibuprofen at this strength is very potently anti-inflammatory, which means it keeps the swelling down. It means it accelerates the healing. So it's not primarily taken for pain, it is to get rid of the swelling. And as a result, the pain goes away. So as pain going away is secondary, and that's how we recommend it.
Are there any group of patients that you would tell them to stay away from ibuprofen?
You are one slide ahead. So ibuprofen cannot be taken to somebody who's had known history of allergic reactions or hypersensitivity, people who have kidney problems or liver problems, because ibuprofen is mainly broken down in those organs. It's contraindicated. For instance, somebody who's on dialysis and so on. But also, somebody who's very sensitive to acids, because ibuprofen and the non-SADs will provoke acidic reactions, so stomach ulcers. That's another contraindication.
With using antibiotics and the ibuprofen, is this a sufficient toolkit to manage pain?
As we know, we live in an opioid crisis. Too many people are losing lives and having some serious health problems because of overuse of narcotic drugs in this country and elsewhere. Now, frankly, dental offices have stopped prescribing narcotics by and large in the past decade or so, and our office is no exception. Narcotics is needed in maybe 1 to 3% of all the procedures we do. And we do a lot of big procedures, but it's surprising, so long as you keep to all the things we just talked about, including the use of ibuprofen, then it is not quite necessary. And those who cannot take ibuprofen, what about for that group of people? Do they automatically need narcotics? The answer is many times the cold control, the swelling control using cold pack, cold rinses, use of Stella Life, and if you want to supplement, you can take Tylenol over the counter, and that is many times sufficient enough to get over this issue.
Awesome. Now let's transition to what we can eat and what we can't eat, unfortunately, because we will have to adjust our diet throughout the healing process. So examples of foods that we can eat are going to be soft, cold foods. Unfortunately, they will need to be bland, but the key here is to avoid foods that are hot. Anything that's too hot in temperature, that's going to increase the temperature of your mouth. Remember that we're wanting to keep the areas cold. And not promote bleeding. So we want to stay away from hot soups, unfortunately, anything that's going to be super hot in temperature, but also hot in spiciness. Now, this might be difficult for you, but you're going to have to try to stick it out. We don't want anything that's going to aggravate the surgical area. It's going to be uncomfortable. We also want to avoid anything that's crunchy. We are trying to sort of baby the bone to grow back. We want to go, from crawling to walking to riding a bike to running. We don't want to overstress the bone too early, which means that you need to stay away from food that's too crunchy, that's going to overstress the bone early on.
Here's an example of a case that's successfully treated. This is a patient with lots of bone loss, and you can see on the x-ray on the left, the darker triangular area represents bone that's damaged, and on the right side we see successful bone that grew back in as little as 7 to 9 months. This is something we can achieve. Now, what is the secret? The surgery has to be done right. The post-surgical care has to be utmost, including what we just talked about, not chewing on that tooth, not putting that tooth to physical stress. Bone needs a lot of nurturing environment to grow back, and harsh environment, physically chewing hard, is a no-no. So for the first 2 weeks, absolutely smooth food, but for the next 6 months or more, you really need to be on reasonably soft diet. If you want to get a result like this person, you need to follow that instruction.
So remember, soft, cold food, nothing crunchy or spicy or that's going to break up into a lot of pieces. We want to make sure that we can walk and baby through the healing process post-operatively.
Yeah, no chewing hard for the next 6 months. The better you do, and I always tell this story, the ones that get the excellent result, maybe it may not be correlated with the skills of the surgeon. many times is how the patient has taken care of themselves. The disciplined ones, the ones that are determined to get the gum and the bone to heal back, do get the result. And sometimes it's something as simple as avoiding certain types of food. So that's one of the hallmarks of laser-assisted new attachment protocol that we offer in our office. Now, after any surgery, clots and excessive bleeding might be a concern. Again, if you follow all the common sense instructions, cold rinses, eating the right food, not disturbing the wound and so forth, then blood clots are going to be there, but we shouldn't really have bleeding issues. If you have excessive bleeding that goes more than hours or days, then of course we need to take emergency care, and that is perfectly fine. But I do want the patients to understand the part of the process of this. What do you see here, Gabby?
I see a blood clot around a tooth.
Yeah, this picture shows the laser fiber. It's a graphics, of course, and where the white tooth is surrounded by this red band of clot. We'll go into that in just a little bit. This is, in a nutshell, what the laser-assisted new attachment protocol is. Multiple steps, which we're not going into the details, but what I want you to know is part of the things that the laser does. One thing that the laser does is kill the bugs very, very efficiently. But the other thing that the laser does, it forms a controlled clot around the gum line so that the body can now build new bone and gum into the missing area. And the clot is literally like a biological band-aid. Here is an example of an area that the laser is being used. The red color is because the laser is emitting a red pilot light, and that's what shows how it penetrates into the depths of the problem. And this is immediately afterwards. You see this band of clot. It's common for people to look at that and get surprised and want to have a temptation to brush that off. But that clot is important. We do not want that clot to be removed for the first 2 weeks.
Dr. Kim, would you say that it's much like a scab, like when you cut yourself, on the outside of your skin and it scab forms? Is that the same thing?
Exactly. Yeah, that's a very good analogy, because if you cut yourself and the skin starts to close up and a scab forms, the last thing you want to do is peel that off or start disturbing it, because then the wound will have to go back to that original spot and start to form that scab. So you leave it alone, the scab will eventually dry off and new tissue will grow and the skin will heal as if there's nothing happening. In the mouth, something similar happens. The edge of the gum will form this artificial scab, which is represented by the clot. You leave that alone for the first 2 weeks, hence very soft brushing and very soft food, but leave that area alone.
So, Dr. Kim, what areas are we allowed to brush when we're brushing our teeth after having the LANAP procedure?
So immediately after the surgery, and especially when you eat food, you're not going to be able to clean your teeth properly, and some people who are anxious about that will get into trouble from time to time. Toothbrushing, here's a simple trick. Here are the white pearly teeth and the pink gums. You are going to get this band of clot, just like the scabs around the edges of the gum. You need to keep away from there with the toothbrush. So this red zone is indicating where toothbrush should not be going, including floss. So the blue arrows here indicate where you can touch the tooth with a toothbrush, but the red arrows say no. So stay in the blue zone and brush the white surfaces, including the biting surfaces. This is looking at the tooth from the side, and here are the red scabs, clots that form at the gum edges. Brush on top of the area, but do not get down to the gum area.
So the key to take away is to stay completely away from the gum, just brush basically the white surfaces of the teeth, and then when we should be good to go.
Oh, and don't forget the tongue. The tongue, just get rid of any gross debris. If there's food stuck in between teeth, I wouldn't hesitate. Use a toothpick, use floss, and get that out. But again, the rules are stay below this red dotted line. And for the lower teeth, it'll be opposite, of course. Brush the white surfaces, brush the biting surface, brush your tongue, but leave the gum area and the junction of the gum alone.
A lot of our patients do a protocol at home called home bleach therapy. If you've had the opportunity to review with us home bleach therapy, it means that you're taking bleach, standard bleach, you're using your water pick machine, and you're getting it inside the gums to help keep the area as clean as possible. after LANAP procedure has been completed, you cannot do bleach therapy for at least 2 weeks minimum. Why is that, Dr. Kim?
Well, bleach therapy, and we will describe this in another video that you can watch just on that topic alone. But home bleach therapy is something that we recommend highly because it is one of the most efficient ways to keep yourself free from gum disease. However, the bleach that gets under the gum and in between the teeth, which is exactly what we want to do to kill the bugs and the bacteria that cause the gum disease, we don't want the bleach to interfere with the healing as we have just described, just like the clot. The bleach will wash away the clot, but more so than that, if the bleach is introduced under the gum, and for that same reason, Listerine and the likes. Anything that gets introduced to this area will not only kill the bugs, it will kill your own cells. Your own gum cells and bone cells that's trying to grow new tissue will be killed very efficiently by bleach and any other mouth rinses. So let's review the healing pattern. This hopefully graphically will make you understand what we're trying to do. This is a typical swelling spread over, say, first 2 weeks of healing under any circumstances. At day 0, we don't feel anything. Usually, the first day, you wake up in the morning, the next day, we say, oh my gosh, I've got swelling. Hence, we want you to use ice pack right away. And depending on how well the medications work, how well the surgery is done, how much cold is being introduced, the plateau can last and start to hopefully drop. But very typically, it will drop after, say, 7 days or so. We don't want that. We want it to peak less, and we want the whole thing to disappear in less than 7 days. An exact same pattern happens with pain. Pain is secondary to swelling and delayed healing. So pain, instead of this big hump, we want a small little hump. And many of our patients do come back with pain disappearing or almost gone at day 3, day 4. So it really depends on how well you take care of yourselves. Please review this video once again and in details. If you have questions, ask us, and our team here will be more than happy to tell you the exact pathway to get you healed fast and effectively.
All right. Happy healing, everyone.
Thank you for watching this video, and further information can be found on our site. You go to askyourperiodontist.com and you'll land on this page. It's constantly being reviewed, and you can find other topics, other issues on this topic. So far, this was Dr. Jen Kim
and Gabby Palacios.
Thank you for watching us. Have a great day.